Hello, I am Amanda Blair, and I am here to talk about a case analysis and case study. Um, my client is a 55-year-old female, married, Native American, Caucasian, mixed race. She is presenting with issues related to feelings of having a lack of purpose in her life. Conducted a biopsychosocial assessment as well as an MMSE and an MMPI 2. General psychological functioning. Client is oriented well. MMSE shows orientation fine. She did well on that and is fully aware, full functioning, it appears, and average to higher intelligence. She her main things were in relation to social relationships, which appear to be affecting her feelings of a loss of purpose or a lack of purpose in her life. She, during the biopsychosocial assessment, BSP, she did talk about some family discord, loss of relationships, specifically the loss of her mother approximately 10 years ago, who was her closest relative, as far as emotionally, psychologically, that sort of thing. She did mention feelings of grief related to that she does not feel like she has completely fully grieved to the point of no longer experiencing sadness and things like that. She did discuss having episodes of feeling blue or sad, feelings of grief, not every day, all day, fairly infrequently, but at times. She did acknowledge changes over the last 6 months, specifically in relation to her life situation. Over the last few years, there have been changes in her job, in her relationships, in her spouse's job. She changed careers twice over the last couple of years, and up until the last 6 months, she was watching her grandson since being unemployed about 5 years prior to that. She did acknowledge that since no longer watching her grandson, and then changes in her spouse's career situation, she finds herself alone a lot more during the day, without things to fill her time with. During the MMPI, it indicated that she has ideas of a persecutionary nature, often feeling persecuted by others, often cynical of others. She has misanthropic beliefs, interpersonal suspiciousness, along with a competitive drive and indications of family discord. I would say that is those indications are fairly similar to what her BSP indicated as far as the family discord. She, like I said, there was a loss of a relationship with her only son. Subsequent to that was also the loss of a relationship with her only granddaughter. There has since been trauma, not only from her childhood. She did experience childhood sexual abuse by relatives, which I do appear to be affecting her now in her adulthood as well. And recently found out that her only granddaughter, who she does not currently have a relationship with or a great relationship with, finding out that she was also recently molested by her step-sibling. So, those are some big changes that she has been dealing with. Based upon that, as well as the indications of the MMPI, and looking into a further diagnosis, it appears that she has an adjustment disorder based upon experiencing episodes of feeling blue, episodes of grief, that do not quite meet criteria for a major depressive disorder or any depressive disorder, as well as lacking all of the symptoms related to any sort of an anxiety disorder. Based upon that, as well as ruling out a depressive disorder, anxiety disorder, and not meeting criteria for other disorders, it appears as if she does have adjustment disorder. Again, related to the changes in her life is the appearance. As far as her social relationships, she did mention that her family relationships, not all of them are very great. Her best relationship is with her daughter. She also has a fairly significant relationship with her brother and sister-in-law. She does have other siblings that she does not have a very good relationship with. They are on speaking terms, but not to the ability that she feels that they are much of a support system for her. As far as friend relationships, she has a large group of friends, a smaller group of close friends, and then she does feel or mentioned feeling that none of her friends tend to know her very well, and that may also play into some of her feelings of her lack of purpose. Treatment will be related to a cognitive behavioral approach, and she does not have any legal problems, denies using any substances. She doesn't appear to have a loss of pleasure in any area. She continues to travel, which is something that she enjoys. Just in the in-between times is where she really feels that loss. Did not indicate any sort of medical issue or medical condition that may be related to her feelings or symptoms. No change in appetite, no loss of sleep, no change in sleep patterns, nothing like that, no anhedonia. And from that, since it does knocks out a lot of the criteria for major depressive disorder, that is why I rolled that out. I believe that is all of it. Overall, her functioning is it's not dysfunctional, but she does feel that it causes a problem to her. Therefore, it does appear to play a role in her own functioning, at least during the times when she is often finding herself alone. She does enjoy being around people, not necessarily large groups of people, but she does like being around smaller groups of people. She is able to enjoy things, as I stated. Treatment will be based upon, or treatment will lean towards aiding her to find a new purpose now that she feels that she has lost her purpose in the role that she played in her grandson's life. So that will be what the treatment goals will be related to.